My name is Brenda Green, and I live here in Columbia, South Carolina, and I am a part of the Patient Family Advisory Council at Children's Hospital Midlands.
My name is Cindy Bork, and I'm a pfac volunteer at Greer Memorial Hospital.
Well, I became a member of the Patient Family Advisory Council back in 2018. I'm a mother of a child with a chronic illness who has been visiting Children's Hospital all of his life. I wanted to be involved in the planning. I wanted to understand this was an illness that my son was something that was very new, and I wanted to be involved.
I had been volunteering at Greer Memorial Hospital, and I was asked if I would attend a meeting and provide some feedback. And after that meeting, I was asked if I would consider joining their pfac. Not knowing what a pfac was or what they did, I did some research and immediately became excited about volunteering in that capacity. And so I joined their pfac in 2019.
The goal of pfac is to get the patient and family voice. That's the part that stands out to me because now I understand that the hospital system really wants to hear the perspective of those they serve.
One step further would be to see that feedback resulting in changes or enhancements to the patient's experience.
The hospital wanted to address infection issues and just something simple as proper hand hygiene, washing your hand before you present or come to a patient room or before you leave the patient's room and go into another patient's room. So that was a project that was brought to us to kind of get some feedback from us to see how the communication should be made to families or those who are provided the service. And we were also approached into actually participating in the project, observing on the different floors at the hospital to give feedback that way. So that was a very important, if you think about it, very important project.
There were many times when aspects of my feedback were implemented in some fashion and sometimes fairly quick. And one example would be a meeting that our pfac team had with a Prisma Health team member where they were updating us on some MyChart updates. And in conversation, she mentioned how the current rate of e-check-ins was at 2%. And I found that interesting because I had recently received an email appointment reminder myself, and I did not recall even seeing the ability to e-check-in. And when I questioned and asked about that, she said it was at the bottom of the email. And I remember the email being very long, and I'm not so sure I went to the entire bottom of it. Several days later, not only did they hear my voice, but they made the change, and the subject line was edited, and the e-check-in was put to the top of the email.
I'm very inspired by the people that make up the pfac that I serve on. You have parents of children who receive services here with Prisma Health. You have patients, actually adult patients who are from the community and have received care. You have grandparents who have had grandchildren to go through the hospital system. And we have our representatives of Prisma who serve on the board to work as liaisons. So it's a well-rounded group of people. It doesn't matter the background, the race, the financial side of it. It was anyone who has received service and care. And we all provide our voice and collectively work together to make sure that we are voicing opinions or knowledge, experienced knowledge, in order to improve care.
I think it's important that the patient and the patient's family's voice is heard because first, their time is valuable. And when a patient and their families feels like their voice is heard, it builds confidence and trust. Confidence that their time spent is worthwhile, and trust that Prisma Health hears what they're saying, and that is playing a role in increased patient experience.
The goal to have a pfac at each Prisma Health facility is definitely stating that Prisma Health wants to hear from their community. They want to provide a better patient experience, and that they are stressing that patient experience is a priority. And I believe that.